I've one son called Danny. He's 31 now and he has Asperger syndrome, but he wasn't diagnosed until 4 years ago. There were symptoms there in childhood, we realise now, but we didn't recognise them, the symptoms, at the time. Now we had been told or had discovered that sometimes during puberty symptoms can disappear. They can either get better or they get worse. With Danny, he got better and we started getting good reports from school, and he got 7 standard grades, and we were told he was university material. Unfortunately, when he was 15, he was given 6 vaccines. They included MMR. This was in 1994. 5 months later he got MR, because that was the year that the government did their catch-up scheme. However, looking back, Danny says that he started to feel different when, after about a week to 10 days after the first batch of vaccines, we saw a lot of social withdrawal. He said he felt very frightened and very paranoid, and he stopped inviting friends to the house. This eventually developed into clinical depression, and he was prescribed Seroxat. He was 16 by this time. He was left unmonitored for 5 years on this drug. We were totally unaware of possible side effects, but this drug made Danny go manic, and eventually he developed an atypical psychosis. At that point he had to be hospitalised, and psychiatrists started an onslaught of anti-psychotic drugs. Certainly this was 10 years ago, and maybe research wasn't so widespread about the side effects of the SSRIs, but it is now. Side effects are well documented on the internet. Over the years, Danny has been tried on 12 different antipsychotics, all of them more than once. He would be given one drug after another. Sometimes when he was given a drug, he would show an improvement at the beginning, then he would plateau, and then he would deteriorate. Doctors tended to raise the dosage when they saw a deterioration. They're trained to treat what they see. But there was actually one 3-year spell where Danny had 15 changes of antipsychotic medication. It was awful. The side effects he's had from these drugs have been horrific. There was a good deal of weight gain. At one point he was nearly 18 stone. Drooling, Parkinsonism, Touretteism. The Touretteism is the worst, because that, apart from a vocal tic and jerks and twitches, he gets bad thoughts. And I've been told the bad thoughts are a type of tic. These bad thoughts, if the dosage was raised, would develop further in that he would start vocalising them, and it became coprolalia, which was really difficult for him. At that time he wouldn't go out of the house because he was frightened of what he would say to people. On 3 occasions doctors put him on depot drugs because they couldn't understand why Danny wasn't responding to drugs, and if they sent him home and he deteriorated at home, they were suspecting parental interference. But when he was discharged from hospitals, he would be given other antipsychotics or benzodiazepines or sleeping pills, which would be removed once he was out in the community, because they had such faith in their antipsychotics. But once they were removed, then we could see the side effects of whatever drug he was on. The depots were dreadful. On one depot, he spent hours every day curled up in his bed in a fetal position, getting what he calls head rushes, and muttering away to himself. These spells would last for hours. But at last, at one of the many tribunals we had, a psychiatrist who specialised in Asperger's told the local team that depo should never be given to anybody with Asperger's because they can induce seizure activity. And she also added that Danny would never get better on drugs, he had to have the Asperger's addressed. This whole story was complicated, of course, by the fact that Danny didn't get diagnosed with the Asperger's till 4 years ago. I've since read somewhere that up to 57% of late diagnosed adults have already been misdiagnosed with a mental health disorder, mental health illness, and this is what we think has happened to Danny. The professionals do not seem to be aware yet that people on the spectrum have difficulty processing toxins, and that includes the drugs. According to anecdotal, there isn't much data around, but I relied on anecdotal evidence from other parents or from adults who have been successfully medicated, and they told me they have only tiny doses, far below the recommended levels that you would find in the Maudsley guidelines book. So it's very difficult. We don't know how Danny would be on a very low dosage of drugs, and we don't know if he needs them at all, or if this whole decade of mental illness has been caused by the drugs he's been given. Thanks to the psychiatrist at the tribunal who said he must have the Asperger's addressed, Danny is now in an autism specific unit going through rehab. He has come on a lot. I can see a lot of emotional healing has taken place, because after almost 5 years of hospitalisation, he was left an emotional cripple. He was frightened to go out in the street, he was frightened to speak to people. And I can see emotionally he has healed, but the side effects of the drugs he's on are still very apparent, and they still cause him a great deal of grief. Fortunately, we now have a local psychiatrist who plans to lower the drugs very slowly and very gradually. And when this happens, we hope to see a recovery in Danny. And we hope that it will prove once and for all that he has been misdiagnosed and been made mentally ill by the drugs that he has been given.